A warm welcome to all of you, and thank you for the opportunity to share Sri Lanka's plans to build back better. Indeed, as clearly expressed in the Regional Director's annual report, I quote, "As we look forward, the challenges is not just to revitalize healthcare, but to regain lost grounds in the health outcomes, rebuild health systems, and to restore trust among vulnerable communities." I close quote. Sri Lanka's strong public health system and overall emergency preparedness under a strong leadership that used the whole of society approach have helped the country to overcome the waves of cases since the start of the pandemic. My ministry worked with other government agencies, military, private sector, local authorities, civil societies, and development partners, including WHO, to achieve our common goal of saving lives and protecting our people. The COVID-19 pandemic has disturbed the continuity of essential health services globally, including Sri Lanka. Under my leadership, I will pursue the primary healthcare recognition that was started even before the COVID-19 pandemic as a means of achieving health for all. I would like to highlight the following points. First, the lessons we learned from pandemic will be integrated into implementing a people-centered, responsive and quality essential services package closest to communities through shared care cluster model. Availability of safe and quality essential drugs will be ensured by strengthening the National Medicine Regulatory Authority and promoting local production. This is a key approach to ensure that no one is left behind, not just from a financial perspective, but also from a human rights perspective, so that all people receive health care with dignity and without stigma and discrimination. Secondly, it is crucial to recognize the unpredictable nature of disasters, emerging threats, devastating effects of climate change, and other hazards. To this end, the country is more determined than ever to improve its all hazardous emergency preparedness and resilience by reviewing our COVID-19 response and updating the National Action Plan for Health Security. We would like to share our best practices and also learn from other countries in the region through active exchange and horizontal collaboration. Thirdly, we need to address the challenges of the increasing burden of non-communicable diseases, which is the leading cause of death and disability in the country. This needs multi-sectorial engagement, educated and empowered communities, as well as a strong leadership and commitment to address the social and commercial determinants of health. As we continue to battle the COVID-19 pandemic, we need to adapt our service delivery models to meet the needs of this group and other vulnerable population. Finally, it is critical for us to realize the centrality of health in achieving the SDGs. Thus, adequate and sustained funding for health will be necessary precondition for building back better. Thank you, and I look forward to an engaging and continuing dialogue with other member states on how we can better work together towards a future in the region that is healthier, safer, and more fulfilling. Thank you.